How's everybody doing? It's Dr. Morris here from Magnolia Medical. Hope you all had a great day. It has been busy here at the clinic. We've been out participating at local schools for Teacher Appreciation Week, and my staff has been nuts. Listen, I wanted to talk to you tonight about not letting symptoms of digestive problems dictate your life. You have to get to the root cause of the problem. And I want to tell you about a patient that we had recently. She came in, she'd been to 5 different doctors for her digestive issues. So she'd been to a lot of doctors, trying to figure out what's wrong with her digestive system. She had some, since we're talking about digestive problems and poop here, we'll try to keep this rated G. But she had some significant digestive problems, and she'd been to a bunch of doctors, and nobody could find out what was wrong. So all they were doing was they kept throwing different medications at her, trying to solve that problem. Now, without trying to turn you into a physiologist here, I just want you to know that digestive problems can come from lots of different areas. But these doctors were not looking for the cause. They were mostly interested in just writing a script and treating the symptoms. Which for this lady, those symptoms were bad enough that wasn't necessarily a wrong thing to do. It just wasn't going to be a long-term solution for her, and it certainly wasn't going to fix the problems. You don't put a piece of black electrical tape over the check engine light in your car and magically believe that the car is now running properly. At least I hope you don't. As it turns out, after she'd been suffering with these digestive problems for quite some time, and all the different doctors she's seen, we were able to accept her care in her case and take her on as a patient, and we started doing a little bit more in-depth testing. And one of the tests that we did with her was a stool test. We did what's called a comprehensive diagnostic stool analysis. And it's not a fun test. Obviously, it is what it sounds like. You have to give a stool sample, which is not fun for anybody. You don't have to do it here in the office. You get to do it in the privacy of your own bathroom. But we took a stool analysis. We sent it into a lab, and in about a week and a half, maybe 2 weeks, the test came back. This woman had 4 different parasitic infections. She had 4 different parasites in her gut. So now you might go, that's disgusting, that's gross, and I can agree with you 100%. That does not, it is gross, it's disgusting, and it kind of gives you the heebie-jeebies. But the truth of the matter is she was very happy to know that there was a cause to her problem. She was quite disappointed that nobody else had looked for those issues. So there are causes to your health problems. What you should know is excess gas, having the farts is not normal. Constipation, not normal. Diarrhea, not normal. Constipation and diarrhea, not normal. Digestive problems are not normal. So if something is going on, if you're having indigestion, acid reflux, bloating, these are not normal and they're not okay. Your digestion is so important, folks. What you eat is going to become the tissue and the cells in your body for the future. So you need to be able to eat good, healthy foods, digest those foods, and absorb those foods in order to have a healthy body. It's imperative. It sounds simple, but it is the fundamental way that you stay alive is to eat food and then turn it into living tissue and energy. So you've got to be able to digest things. And when something's wrong, it's going to impact your body's ability to do that. And so it's going to impact all of your health. Don't let digestive problems go, don't let the cause of digestive problems go undetected. You need to find out what it is. If you need help with their digestive symptoms, folks, we're getting amazing results with our functional medicine program as it relates to digestion. So if you're having problems, you should call our office. You should get on our schedule. Ask for my full-length video on digestive problems. They will send it to you. We will send you a link to it, or we could even send you a DVD. But we will send you a video about our digestive program that we have to help people with digestive issues. I actually even had a lady recently. Oh, get this. This is a good story. Okay, So I had a lady recently, she came to us and she was having severe stomach pain. She had had a procedure done on her stomach to help with a hiatal hernia. She had a procedure done, and it resulted in several trips to the emergency room after the procedure, and it also resulted in her not being able to eat anything other than pureed chicken and pureed rice, and occasionally like an English muffin or something like that. So this was her entire diet in her life, and her entire life was eating pureed chicken and pureed rice in a blender. Oh, she could eat some baby food. That was another thing she could eat. And she was told that through the surgeries that she had, because she ended up having to have multiple surgeries, she was told she had gastroparesis, which basically means paralysis of her stomach. So she would eat something and her stomach would not empty, so the food would just sit there. The body would be releasing acid, and she would get in tremendous amounts of pain, and she had several trips to the emergency room just for that. So her stomach wasn't working, and they told her nothing could be done for it because they had nicked the vagus nerve when they were doing one of the surgeries. That was their thought process. And so we actually started to work with this woman, and in a very short period of time, just a matter of a couple of weeks, some of the therapies that we're doing, some of the changes we helped make for her, she was actually able to eat normal food. And she's tried some unhealthy foods. And if you're watching this, you know who I'm talking. If you, my patient, are watching this, you know you shouldn't be eating unhealthy. You should be trying the healthy foods too. But the good news is she was able to go back to eating a normal food. She was able to not just have to eat pureed chicken and pureed rice and baby food. She was able to eat normally. So the lady with the parasites, well, we're going to be working on those. We're going to solve that. She's already feeling better. So these problems, just because your doctor doesn't find out where they're coming from or they tell you nothing can be done, I want you to know that's not true. You should seek for a resolution of the underlying problem, not just symptom resolution. Again, if you have digestive problems, call our office. The number here is 615-225-9100. Ask my staff to send you a link to our digestive health video. After you watch that video, if you like our approach, you can call and set an appointment. But more than you coming into our office, the more important thing is that you do not suffer with digestive problems and that you continue to work at finding the cause of those problems instead of just treating the symptoms. Folks, it's Tuesday. I hope you're having a great day and a good evening. The Preds won last night, so go Preds. Hopefully they beat the Jets tomorrow night. And for those teachers out there, Teacher Appreciation Week, we appreciate you, and we will see you next time. If you guys have any comments on this video, please leave them. I saw somebody give me a couple of likes on there. You guys can hit some hearts on there. You can press that button and like it. If you can share this with your friends and family, somebody who is suffering with GI and digestive problems, this could just change their life. So share this. You never know who you might share this to. Even if you just share it to your page, somebody might watch this and they might say, hey, you know what? There should be something that can be done. I don't have to suffer. So hit that share button. Appreciate you watching, and I will see you soon. Bye now.